Yeah, it's 20 minutes past 7, an hour later in New South Wales. We'll check your weather with the Bureau of Meteorology after 7:30 this morning. We've been talking about migraines. Dominic Forsythe is at the Gold Coast Headache and Migraine Clinic. He's told the ABC's Kirsten Webster the drug shortage is having an impact here.
Yeah, we're seeing a big increase in current clients and new clients that are coming into our clinic that aren't able to access their CGRP medication that might have previously been effective. And we're seeing quite a lot of worry around not getting the symptom relief that they're used to and looking for other options.
What are the options if you don't have access to these drugs, which migraines are pretty debilitating, aren't they? So you can understand the worry.
The concern is quite high. Obviously, keeping in discussion with your GP about other medication options is sensible, and having a really a wider look and a close look at the cervical spine through a trained physiotherapist is really effective. So if we can find that upper cervical spine is involved in a patient's symptoms, then skilled physiotherapy can be really effective at helping manage those symptoms.
And that's the approach you take at the clinic. You're not relying on drugs to prevent migraine. You're more looking at the root cause, are you?
Yes, we're looking for root causes and areas of the body that are contributing that can be really successfully treating symptoms.
Dominic, what are the stories you hear from people that do suffer migraine? We hear about them, but you must be at the coalface there of people that are really suffering.
Yeah, some of the stories are quite horrific. A lot of people on the Gold Coast are, not able to leave their house during sunlight hours, or significantly worried at certain times of the year that the weather is going to impact their work. Most of our clients is having 1 to 2 migraines a week, or multiple per month. It's really impacting their ability to work, go to school, study, or just pursue life in general.
Do we know the real reason why people get migraine?
There can be a few different reasons. We know that it's a central nervous system event, and a lot of that is centered around a sensitized brainstem. More research is showing that there can be involvement of the upper cervical spine in sensitizing that brainstem, and the Watson Headache Institute is showing some really good signs in being able to assess and treat that condition.
Do you think people that don't get migraines just find it hard to contemplate what it's like to suffer? Because it sort of sounds like just a bad headache, doesn't it? But it's much more than that.
Yeah, I consistently hear that it's a condition that people who haven't experienced it aren't able to contemplate. There's a lot of frustration within the migraine community at people not being able to understand what they're going through, particularly employers, partners, family members. It's quite a concern.
That's Dominic Forsythe at the Gold Coast Headache and Migraine Clinic. It's 22 minutes past 7 in Queensland.